So one of the
So
goals of Regan's foundation as well is to raise awareness for lupus, and that's a huge issue as well. There's not a lot of awareness out there in the general population. So when it's been talked about in the news a lot lately, you've got the media and there's all kinds of discussion around hydrochloroquine and what it's used for, and with the president of the United States actually mentioning the word lupus, it gets more awareness out there. Have you seen anything change from your end as far as more awareness or more people asking questions or more people looking for information from you because of what's been happening lately?
Yes, and I agree. I think that lupus is still under-recognized, and that's positive. That's maybe come from this is there's been a little more discussion of what is lupus from people who are curious and may not have been aware of it. I think the hydroxychloroquine question is important as well. Um, and I might just spend a little time on that and the issue of medications, because that's one of the things that we get asked about commonly. I think we've shown that hydroxychloroquine is really important in lupus. And so that's one of the things that I'll say as a physician who treats lupus patients. When we saw this being considered as a treatment for COVID, we immediately got worried and thought, gosh, we don't want to see shortages for our patients. Unfortunately, we have had a number of patients say that it's been harder to get at the pharmacy lately, and I think that looks like a fairly premature rush to judgment about whether this would work for COVID. I mean, the studies are ongoing, but it's fair to say that the results so far are a mixed bag at best as far as whether hydroxychloroquine actually has a benefit in either preventing COVID or treating COVID after you have it. That's in contrast to lupus, where there's really clear benefit of hydroxychloroquine in lupus and also in some other autoimmune conditions. So we have, through our various societies, been lobbying hard to say that obviously we support studying any drug that might help in COVID, but we don't want to see shortages for our patients, because there are a bunch of patients that really need this medication. I think we've definitely helped raise awareness in that way, and I hope that the situation continues to get better. I think given the current hydroxychloroquine data, the attention may shift to other potential treatments anyway, and then that will be good. But there's clear benefit in lupus. It's one of our more important drugs that we use actually right now in lupus. I'll maybe just say generally too, we want, this isn't exactly your question, but I just want to make sure that I say it, is that we generally want everyone to continue on your current medications. So we've talked about how we're unsure whether the immunosuppressants would put you at any increased risk of getting COVID. There's a theoretical risk there, but there's definitely a risk from your autoimmune condition and from lupus if you're prescribed medications to control your lupus and you stop them. You could be at risk of a bad flare. And that's sort of a clear and present danger. And so we have been advising everyone to continue taking the medications you've been prescribed for lupus or any other autoimmune conditions. If you have concerns, then contact your physician's office. But the best advice is to keep going with what you've been on to try to keep your lupus in control, because a flare is a real risk for people stopping their medication. And so both in the case of hydroxychloroquine, where we didn't want to run into a shortage situation, and also with other lupus medications, those medications are doing something, and the general advice is to keep on doing what you've been doing for your lupus. Raise any particular concerns with your physician, because there could be some trade-offs in your particular situation, but as a general advice, not to stop all your medications during the COVID crisis.